Well, everybody, welcome to Health Coach 7, the broadcast here on methylation and inflammation. We started out this series with the putting bad genes on good behavior, and then we did session number 1, which is genes and methylation, and session 2, which is metabolism and methylation, and session 3 was immunity and methylation, which we have some things on immunity that I wanted to cover as well, like Epstein-Barr virus and virus activation, which you can probably see on social media recently, which I'll cover, as well on a different segment. And then today, inflammation and methylation and its relationship. So I wanted to welcome everybody. We got quite a good showing today. And I wanted to say that you can ask your questions. I'm going to leave approximately about 7 or 8 minutes for questions, but I wanted to brief you on the elements here that are involved with genes and methylation. This is being recorded, so you can listen to it at another time. And I wanted to be sure that every one of you are hearing me well. So raise your hands if you're hearing me. You can just hit that little hand button, and yep, I can see good hands coming up there. Just push that little button there, and that's awesome. Several people are raising their hands. That's awesome. And you can type in your questions. You're able to type your questions in as we go along. So feel free to begin typing those questions as they come in, and then we're going to start the briefing here now so that you understand the relationship. Now, we're starting off with, you can see on this screen here that there are several genes that are involved in the inflammatory process, and we broke them into immune efficiency and inflammation and gut efficiency and inflammation. And the inflammation cycle on the conversion report on Health Coach 7, you can see which genes are involved in the inflammatory process. But every single one of these genes that you're seeing here highlighted in these grids in both of these categories are involved in some inflammatory process somehow. And there are even more genes that are involved. The ones that are just really highly inflammatory genes are the NR1I2, the PTGS2, the SH2B1s and 3s, the TACR1s, the ATG16L1, the C-reactive protein, which is CRP, and the HLAs, which are antigen processing genes. But there are more than those. And I wanted to give you an idea of which genes are involved. So I'm pulling up on the screen here. Can you see the screen? Everybody, raise your hand if you can see the screen. Okay, has everybody seen the screen on your computer? Just hit the raise the hand button. Yep. Okay, so you can see. Great. So now it's very important to realize here the involvement of these genes. Okay, so now as you can see on genecards.org, I did a search called methylation and inflammation, and the genes that are involved in that are approximately 1,084 genes that are involved in the methylation inflammation relationship. And you can actually explore these yourself by just typing in methylation and inflammation in genecards.org, and you can get to see exactly what these genes do. And as you can see, C-reactive protein is there, tumor necrosis factor is there, interleukin 6 is there, COMT you probably recognize as catechol-methyltransferase is there. So a lot of the methylation genes, as we go to this grid here, you're going to see the methylation genes coming up as part of the cycle too. So a lot of these genes, the BHMT, CBS, COMT, GAD1, these are all going to come up in the inflammatory pathways as well because they're all related to the inflammation process, okay? So you need to realize that it's not just one set of genes that cause a problem. And you remember when we talk about inflammation, we're talking about causes of inflammation that can occur in various systems of the body. For instance, the gut and digestive tract, the cardiovascular system, the immune system can actually cause provocative inflammatory changes. So you've got those relationships right there to be thinking about, okay? So it's very important to know that and not just think that it's just fixing the methylation process to correct the inflammation. It's quite the opposite, actually. You actually have to address the other areas that are the causative factors of inflammation to first before you try to influence methylation, because remember, it's like putting the cart before the horse, right? You don't want to be helping with encouraging inflammatory processes. And believe me, if you actually work on methylation first, you might just be causing more provocative inflammatory change. So you just want to be focusing on the things that are causing the burden on the methylation cycle. And inflammation is one of those things that can cause that burden, okay? Just very important to remember that. And as we go along here, what I wanted to show you is I wanted to show you some of the cycle that's involved here. So as you can see, here we've got various type of things that affect. This is a really good, simple diagram that is in Nature reviews that show the anti-inflammatory pathways and the pro-inflammatory pathways and some of the cytokines that are involved, and basic ones like the interleukin 10 and the tumor growth factor beta and the interferons, tumor necrosis factor, interleukin 1s, the HMGB1 gene is involved in that. I mean, there are several genes that are actually in this movement, and you can see that they're integrally involved with immune function. And it's important to know that inflammatory cascade and immune cascade are very closely, tightly wound together. So when you have systemic inflammation, you've got a lot of immune reactivity and movement that way. As a matter of fact, I don't know if some of you realize, but there is a very special type of pathway known as the apoptosis pathway or the apoptotic pathway. And that pathway is actually what they call the cell death initiating pathway in science. That's the normal process by which cells that are damaged will go through a process of cell death. And of course, in cancer medicine, that's a big area of study. And the inflammatory process is integrally involved in this apoptosis pathway. But as you can see, from a very basic standpoint, shock, trauma, infection, loss of circulation, damage to tissue, repeated injury, chronic autoimmune reactivity when people are having a lot of inflammation caused by antibody formation and excessive immune reactivity. All of these things initiate these cytokines that can cause trouble if they're not corrected. And then if you're looking here, it's important for you to remember that there are epigenetic mechanisms in inflammation. And epigenetics, remember, is the programming by which we can actually change negative signals into better signals that will influence our genome as a whole. Okay, so remember that sensitivity and susceptibility of your genome. You have strong points and weak points. We all do. And the epigenetics is that system by which we can change those weak links, and we can do it strategically. But this article is a great article on, I would say, epigenetic modifications when we actually are exposed to environmental stimuli. And if you read this article, it's not very hard to understand. It actually starts going into, various things like when we have different nutrient deficiencies, toxins, infections, exposure to damaged tissue. How does our genetics adapt to those particular changes? And the epigenome is one of those characteristic intelligence bodies that will actually have that fundamental role in assisting with better gene performance and better gene expression. And if we actually have too many genes that are not favorable ones that are being turned on because of excessive exposure, obviously we want to discourage that type of activity. And infections, susceptibility is one of the biggest ones there. And those methylation challenges and inflammation can go either direction. They can go either for a hypermethylating type of process or a hypomethylating process. Either way, you don't want to encourage, either direction. And the methylation cycle is pretty much controlled by your genome. And each cell, remember, there's 40 to 60 trillion cells of your body. And my body, the human body, actually contains those many cells. They're all methylating at their own rate, controlled by pretty much the genome. Okay, so it's very important to realize that very crucial balance there. Okay, now when we're looking at DNA methylation changes, we think of inflammatory process a lot. So people that wind up having a lot of issues that surround that are individuals that are experiencing a lot of excessive autoimmune disease, people that actually have incredible amounts of inflammatory change in their cardiovascular system. And remember, family dynamic and family history can actually contribute to these type of changes. Like if you're, previous generations, your mother or your father have cardiovascular disease and inflammatory sensitivities, and they developed coronary artery disease or circulatory diseases associated with cardio changes or brain changes, stroke, aneurysms, weak vessels, etc. These are things that we're talking about that are susceptibilities that can be seen in your genome. Okay? And like, for instance, TACR1 is one of those genes. It's known as substance P. It's a neuropeptide that is very active in the movement toward inflammatory mechanisms. And there are many people that are coming up with a lot of double positive and heterozygous patterns in TACR1. And one of the issues there is that the brain is very, very sensitive to changes, and inflammation is a primary functional inhibitor of brain activity. So, like in other words, it can repress activity in the brain. It can cause inhibition toxicity, and that's why we say that when people are having a lot of gut problems, they're also probably going to be sending a lot of inflammation signals to the brain too, and that is so true. So when we look at this inflammatory bowel disease connection, Crohn's, colitis, some of these other issues here, this is a very good article that explains the relationship and methylation patterns and the various type of enzymes that are involved, the DNA methyltransferases and so on and so forth. Yeah, it's a little bit detailed, but it actually talks about the relationship of immunoprecipitating activity that actually will cause more disease process to occur. Okay, so very interesting article as you go through it, and it's going to actually show you proof for how these genes are affecting mucosal surfaces and which genes are involved and so on and so forth. And the study itself is not that old, and we're actually finding more and more. Obviously, this study was done in 2014, it's just last year, so it's a fairly brand new study. And I think you should read through it. You don't have to be a scientific genius to understand some of it. And if you have questions, you can always ask me, of course, and I can always flesh it out for you. But DNA does play a leading role in expression of various type of diseases that are associated with inflammatory change. And inflammation or prolonged inflammation is a problem. Okay, so just remember, you can't sidestep the fact that methylation is affected by inflammation. Inflammation profoundly affects the methylating cycle. And if you're the most important thing to remember is that we want to create better epigenetic signals that are going to create the opportunity to beat the risk. Okay, now this is an older study here on the Journal of Internal Medicine, which is a more popular journal. But this is actually talking way back in 2007. They were talking about the impact of inflammation on epigenetic DNA methylation, and I think that you should probably look at this study because it actually was just demonstrating the various type of hypermethylating patterns in people in general. So the present study demonstrated here in this the global DNA hypermethylation is associated with inflammation and increased mortality in CKD, okay, which was actually chronic kidney disease. But we also can see the same type of patterns of hypermethylation in atherosclerotic process and aging and inflammation, as well as cardiovascular disease in general. So when you go to the doctor and the doctor is telling you that don't worry about it, your genes are going to protect you, if there's cardio disease in the family and they're giving you this false assurance, I wouldn't buy it, because the proof is in the pudding. Inflamed patients, inflamed people, prolonged inflamed people have more accelerated aging and more damage to healthy tissue. And I'm going to say that if you have any of those risk factors, we want to really work on better epigenetic programming to change those risk factors, remove the oxidative stress, quench the free radical load, help with pro-oxidant defenses, increase the body's ability to create better signals, and those genes like TACR1 and ATG16L1 and some of these other MTHFR and some of the methylation support genes, COMT. Hey, if we've got a lot of inflammation happening there, we know we're going to have an upset, and we have a double positive mutation on COMT, that methylation is going to definitely be affected by inflammation. And as you can see in this study, hypermethylation is more of the impact here. So as I think it's really essential for us to pay attention to those things and don't put the cart before the horse. If we've got methylation disturbance, let's use that as the indicator window. Remember, it's an integral part of metabolism. We discussed that in the second session, that you can't separate methylation out from the metabolic movement. It's a window into the metabolism as a whole. And then when our metabolism is upset, it's most likely due to the fact that we have some kind of resistance somewhere, some type of a negative exposure somewhere, some type of a challenge on the system that needs to be balanced. If it's not a serious genetic flaw or genetic aberrant, it's like, for instance, if a person has a inherent inborn error of metabolism, that's different. Okay, that's actually a mutation that's associated with creating a inborn error of metabolism. We're talking about more epigenetics, which means that a person's genome is intact. They don't have serious chromosomal translocations or deletions on genes. They actually have mainly more characteristic epigenetic shifting that's going on, maybe not in the positive direction. So anyway, I'm going to leave it open for questions right now. So please ask your questions. I'm open right now to the questions. You can write them out in that little question box there, and we will actually get that going for you. I hope you're finding this helpful. Those of you who are finding this to be useful, please raise your hands. Let me know that you're finding this to be informative and leading you to understand methylation a little better. Yes, I see several hands. That's very, very, very good. And for those of you who are not, you can always ask me questions. You can always email me privately, and I can actually focus in on some of those questions too. A very good question out here. What nutrients aid in inflammation that aren't methyl donors? Very, very good. I would say one of those are known as NADH, which is actually a niacin-based type of nutrient that's actually involved in coupling of ubiquinone, which is known as CoQ10. And both NADH and CoQ10 are very strongly anti-inflammatory in their actions. Okay, and usually people take anywhere between 50 and 200 milligrams a day. But I would say taking the CoQ10 by itself is kind of like taking the wind out of the sails, so to speak. I like to say people take a little bit of NADH, like 5 milligrams, along with 50 to 100 milligrams of CoQ10. And believe me, CoQ10 is used very powerfully in cardiovascular diseases as well as cancers to assist with defending against cancers. Okay, so a very good question right there. Another one that could be used strategically is calcium folinate, which is a non-methylated folate. Calcium folinate actually assists with the defense movement, and if there's any type of pro-inflammatory pathway that's activated, folate seems to work in a favorable direction. Another one that really works well is something called tirasilbine, or some of you may know it as resveratrol, which is very strongly anti-inflammatory in a non-methyl donor. So those are some things that you might want to consider to put into your plan as anti-inflammation. And there are several more, of course, but I don't want to be developing a nutrition plan here by not having good, thorough analysis done first. But those are a few of the things that I would recommend you look at. And then you can actually do some research, very good research in the anti-inflammatory nutrients that are non-methyl donors, and Google actually comes up with a list. So that's very good. Does vitamin C have a role here? Absolutely. So to answer the question, vitamin C is a very strong not a pro-inflammatory movement. It's a anti-inflammatory movement. So what it does is it actually quenches free radical process, and it actually facilitates better pro-oxidant defenses. And I would say that vitamin C is a very strong protective role in inflammatory process. And believe it or not, vitamin D does too. But part of the problem with vitamin D is that if you have either hyper or hypomethylating extremes, sometimes the vitamin D can provoke more inflammatory activity, unfortunately, even though it's used for keeping they recommend it for cancer therapies as well as better mineral absorption as well as anti-inflammatory. The only exception to that rule is that with vitamin D, you have to be sure that you're looking at your gene expressions with COMT and BHMT and CBSs because of the fact that if you give too much vitamin D, it can really aggravate the inflammatory pathway too. So very important to know that. Very, very good question. Both questions are excellent. Do we have another question out there? Feel free to just ask that. No question is a dumb question. That's very important. Not with genetics because there's so much to learn. And so I say, sometimes these questions, when they're asked, it provokes a whole new sea of movement so that we can figure, wow, that I never really thought about that. I got to be thinking about how that might affect that pathway. So there's no such thing as a dumb question. Not here. All right. Another question that we have here, is homocysteine involved in the inflammatory process? Yes, it is. Homocysteine actually is a abrasive amino acid that is actually seen more when there is more damage in the vessels. Okay, so like in other words, it provokes it. It's like taking a scouring pad to the inside surface of your intima of your vessels, and then you know what happens from there. You got all kinds of platelets and this and that are going to go there, calcification, and if you have prolonged activity like that systemically, that's where atherosclerosis comes in. So arteriosclerosis comes in by repeated injury, continuously, and inflammation. So homocysteine is an indicator of excessive inflammatory pathway as well as methylation disturbance. Okay, very good question there. Is resveratrol considered a phytoestrogen? Yes, it is. However, the thing about the resveratrol, though, is that it could be very balancing on estrogenic imbalance, or estrogenic receptor issues. So women that actually have a problem, or even men too, with aromatization, you can find that resveratrol can be a very powerful, adaptogenic, if you will, phytoestrogen to assist with estrogen balance. However, in cases with cancer, they've been finding out more and more if you have an estrogen receptor positive cancer, that you don't want to even give phytoestrogens because it might provoke more estrogenic movement and proliferative change in the cancer. And that could be true. That's not proven 100%. You got to remember that sometimes these cancers are inflammatory based, and resveratrol is a very powerful anti-inflammatory botanical, and so or bionutrient. And I think that we can't just throw it out for the sake of saying, oh, well, it might cause more estrogen issues and cancers that are estrogen positive. I wouldn't run to that right away. I would say its anti-inflammatory and anti-neoplastic or anti-cancerous properties far outweigh its phytoestrogenic, its negative estrogenic, I should say, activity. The phytoestrogenic is not negative. Phytoestrogen is a good thing because it can actually help with what they call receptor modification. Okay, so I'm not dissing resveratrol as a agent to be used. Very good question. I like that question. It's a very strategic question too. Can you test for epigenetic effects? That's another excellent question. That is very difficult to do, and we're finding more and more that with pathway genomics, we're going to have to improve on our ability to assess different pathways. And nowadays, what we do is we know that we got to focus on elimination techniques and helping strengthening the different systems of the body. And we're going to find more and more that there's going to be some epigenetic ability in testing. If when you do your 23andMe raw data, that's the first step in assessing your susceptibility and sensitivities to see where we need to change epigenetically. So you're going to find more scientists, and I'm always thinking about ways that we can epigenetically test for better efficiency. So now the thing about it is, remember, your genome is what it is. So if you're a black striped zebra with white background, you'll never be a white striped zebra with a black background. And I like to use that because epigenetic signals do not change the genome. Epigenetic signals change the influence upon the genome. Okay, so that's what you got to remember. Very good question. I just love these questions. Well, we're out of time, everybody, and it's so great to have you all. Spread the word to your friends because each one of these segments are recorded. You can listen to them later. But we've got, if you look at the agenda, we've got several great topics coming up, and we're going to be covering those. And of course, as we go along with methylation, there's going to be some questions like I saw today with regards to methylation and viral exposure. And one of the things that I say there is that if you're going to address methylation first without addressing the viral exposure, you're going to have problems. Because remember, methylation is the cycle by which DNA regenerates, and if we are encouraging regeneration of unhealthy DNA that's been by a cell that's been infected by a virus, we've got a problem because we're only going to be encouraging more viral cells to be stronger than the cells that be, and the autoimmunity that exists from that whole process, because the immune system is going to be on overdrive. We're going to see some issues there. So we always have to deal with the elements that are influencing methylation. So if you got a virus and there's autoimmune activity or post-viral reactivity or bacterial exposure, or like in cases of Lyme disease, you got to be addressing those concerns first before you work on methylation, because influencing these areas first will have a profound effect on easing the burden on the methylation cycle. And then when you do make some corrections bionutritionally and epigenetic changes that you make, the methylation support that you have may not be as to the extremes that you're seeing where people are having bad reactions, right? So you might find that you might tolerate methyl donors better if you don't have any stressors on the methylation pathway that are continuous. So it's very much important to be strategic in addressing the other issues that are causing the methylation challenge, okay? So remember that. It's very important for you to remember. Um, is there a reason that uh, I would not be absorbing vitamin D when I'm taking 50,000 units? Yes. The vitamin D receptivity, if it's off in the cells, every cell of the body, it is responsible for uptake of vitamin D. And if you actually have slower uptake and not uptake enough, you got some other issues that need to be looked at. And I would love to go into a greater measure of conversation with that. So that is something that I will look into, and I will get back to you further on vitamin D's influence and why taking high amounts of D is not influencing my reference ranges, and my D still stays low. So that's a very complicated one, and I will get into that some more for sure. Why don't you can actually always send a message via email and remind me, and I will actually discuss that with you in a greater detail. What about the chelating agents as a preventive treatment in people who are prone to inflammation? I think chelating agents are great, but you got to also remember that chelating agents are always going to push the body into a detoxification movement. And if your body is prepared well for that movement, no problem. But you don't want to have continuous chelating happen, because what happens there is that you might be influencing other mineral balance by creating, what they call malabsorption imbalances that occur with chelating. So chelating toxic metals out, of course, is always encouraging, but you got to remember that when you chelate, you can also chelate some electrolytes and you can chelate trace minerals. So you have to be strategic about when to chelate, and how often. Okay, if a person's having a lot of heavy metal challenge right off the bat, there's going to be at least a good 6 to 8 month period of gentle chelation, not going to real severe chelation, because otherwise a person can become very sick. Okay, but that's an excellent question also. So it has to be a strategic plan for chelation. Do infectious diseases and environmental factors cause inflammation? Absolutely. They're number one on the list for sure. And is inflammation one of the things that can aggravate things like endometriosis or endometriitis or any of these reproductive inflammatory processes? Yes, you can. And a lot of times, sometimes you can see the CRP elevated or HSCRP elevated with non-specific inflammatory process. And believe it or not, I've had a lot of patients over the years that have elevated CA125s but never had any kind of ovarian cancer, but they had inflammatory activity on the endometrium, and their elevated CA125 was a result of the inflammation associated with the endometrius inflammation. So yes, so you can have ovarian inflammation, fallopian tube inflammation, and remember, and uterine inflammation. All those things can predispose you over a long period of time to cancerous change, because prolonged inflammation actually can do that. Okay. I love those questions. Thank you, everybody, for your attention. And it was wonderful seeing all of you. You can listen to this again. It'll be posted early next week on the methylation and inflammation, and look forward to the rest of the schedule, because we got lots of great topics coming. Share it with your friends, and you'll be seeing the postings, because I'll be posting every time. And listen to the other sessions, because everybody's just giving us lots of great feedback, getting a lot of great people registering. And so feel free, send your email your questions if you have further ones to info@healthcoach7.com. I'll do my best to try to address as many as I can. I can't get to all of them, but I will be very attentive, because that's how we get the information out to help people more. And that's what I'm really interested in doing, is to help people understand genetics, and personal applications in genetics are very important. And then these studies will actually be, you can ask them, you can request them by email. They will be part of a PDF. We were trying to put the links on there, but sometimes the links, they outdate themselves and they're no longer valid. So we will have the PDFs of these research articles. If you want them, you just request them by email at info@healthcoach7.com, and pay us a visit at www.healthcoach7.com, as we're always updating our information. And it's pleasure being with you today, and I look forward to seeing you next week. Thank you. Bye-bye.